it's Professor Kristen. And one of the things that can be a little bit of a struggle for nurses, nursing students, is donning and doffing proper PPE, personal protective equipment. So this video is to show you how to don and doff just basic personal PPE, including your gown, goggles, gloves, and mask. So let's get started. So before we enter into our patient's room, we need to put our PPE on or don our PPE. The first thing we're going to want to do is do hand hygiene. I'm actually using my gel, and know if you're in a hospital or a clinical facility that has hand gel, you gel in and gel out. If not, please wash your hands 20 seconds with soap and water. Once dry, then I'm going to first put on my gown. Facilities have different PPE just depending on where you work and what you do. I want to go ahead and put my arms in to my gown, and you don't want to leave your gown hanging like this or barely putting it on. You want to tie everywhere there's a tie, or bring it around if there's a Velcro, or whatever needs to be put together. Please put it together. There's a reason it's there, so please do it. So we're going to go ahead and tie the top. I'm going to actually kind of flip my gown, and then I don't come around anymore. We don't want to bring our ties around. These are too small for me to come around anyway, but sometimes you'll get gowns that have long ties, and it has been proven that when we bring it around to the front of us to tie, when we go to doff the gown, we are actually spreading germs to ourselves and to others. So let's go ahead, and we want to tie to the back, and our gown is on. The next thing we want to do is put our face mask on. Now, if you're going to put on an N95 or another type of respirator, I do have a video with Professor Kristen that talks about donning and doffing an N95 mask. But for today's video, we're just going to use our normal surgical mask. When you're at your facility, you will want to put the mask on what masks are there for you to use and what they have. So it's all based on what equipment is at each facility and their protocols and policies. But for this video, we're going to just use the actual regular face mask. And so what we will do is you want to go ahead, and I slip mine just a little bit under my glasses so that I don't fog up. And I want to press on my nose, and as I'm holding my nose piece, I'm going to take the straps and go behind my ears. I also want to pull down, holding the nose piece over the chin so that I get good coverage with my mask. Now, another way that you can put this on is when you put it on, when you put it to your nose piece, hold before you put your earpieces on, and you can pull the bottom to pull it down to make sure that's going to cover the chin. Personally, I like putting on my ear straps and then pulling it and adjusting so that I'm right there where it needs to be. Mask is on. The next thing that we want to do is we're going to put on our goggles or face shield, our eye covering. Now, I wear glasses, and in the clinical setting, when I'm working in a hospital or a clinical setting of any form, I want to keep my glasses on. I can read, I can see better with them. I can wear contacts, but I prefer to wear glasses to work. So I actually have a pair of goggles. So I will open the goggles, and I'm going to slip them on over my glasses. So my goggles are on. Note as I'm putting these things on, I'm not handling everything with my hands all over. I'm trying to touch just my nose piece, the bottom strap or the bottom piece of my mask, and also the sides of my goggles to make sure everything is on appropriately. Then it is time to put on my gloves. Now, I'm just using regular gloves that are usually what you see in the hospital. It all depends on where you're going. If you're going into the OR where it's a sterile area, then you might have sterile gloves to put on. But for this purpose, we're going to just don regular gloves. So I have the blue nitriles. And when I put them on, I want to make sure that I cover all of my wrist area. So I am going to pull over my gown, covering the wrist area. The point is to protect you and also to protect your patient. So I have now just donned my PPE properly. Gown, mask, goggles, gloves. Time to go into my patient's room. I'm completed, I'm in my patient's room, and now it's time to doff what I have on. Now, I'm considered dirty at this point, so I need to be very careful what I decide to take off first. Not only just to protect myself, but also to protect others. I don't need to be throwing this here and there or walking outside of the room with any kind of PPE on that could harm others. So the first thing that I will do is to remove my gloves. They're dirty, I've been touching whatever, and I want to take them off. I personally like the glove-on-glove removal. So there are other methods of removing your gloves. There is a beaking method. I'm not very good at that. I'm not even going to attempt to show you that. I like this. I feel it's cleaner and it's just my way, and I've done it for 27 years. So what I do is you want to I pinch the glove and I remove it, taking my hand away. With the hand that still has a dirty glove on, I ball the dirty glove into my hand. With my regular hand, I'm going up under, and I'm going to just go ahead and I bring my gloves over the other, making them together one thing. They're ready to be thrown away. They go into the trash. Then I need to remove my gown. So what I want to do is you want to untie. You don't just go grabbing and breaking and pulling off. I want to go to the back and untie or break gently. I broke mine. It's a little bit easier than trying to find the tie. And then I also want to go behind the back. Now, noting that the front of my gown I'm not touching, right? Because I've been up against something or near my patient or whatever, considered very dirty. I've broken my ties, my gown is off. Now the ticket to this is to roll gently the gown off. You don't want to just pull here or anything like that. That's a big no-no. Instead, you're going to start at the top, back at the shoulders, and you're going to bring the gown down. As the gown is down, you can go ahead and start to pull off the arms. And then once here, I'm dealing with the inside of the gown. I just want to kind of roll it gently. Notice that what's on the outside has been in. I rolled the gown and it's ready to be thrown away. Now, I can now do hand hygiene. I want to gel, clean my hands, make sure that they're good and clean. And I'm going to remove my goggles. Now, when we deal with our face and we deal with our goggles or our respirator, we don't want to handle all the front. You don't want to be grabbing, touching, any of that. This is all considered dirty at this point. So removing the goggles, I'm going to take the sides. I just want to pull them off gently. And I'm going to set these down because they need to be disinfected. And I have some alcohol spray and towels to clean those. If I was using something disposable, it would go into the trash, but I'm going to keep those and clean those so that I can reuse them. Next thing I want to do is remove my mask. Now, to remove the mask, never touch the front. Any mask. This is considered so dirty. You've been breathing in and out through the mask. We don't want to touch this. It's usually full of particles, contaminant, different germs, and we just don't want to get that all over hands, touch anything, and cause issue. So what you want to do is to go ahead and come off of the ears, remove the mask away from you, don't bring it to you, but away from you, and go ahead and put it in the trash. If you have your N95, then we want to go ahead and doff the N95 per the video that I have on donning and doffing N95. Now, once I am done, I've removed all my PPE. Once again, hand hygiene. always. And if you don't hand gel, please wash your hands for 20 seconds with soap and water, at least, if not longer. I'll go do whatever I need to do until I need to put my PPE on again. I hope this helps.